Okay, so I'm doing it now and I'll make you back here. Okay, so you should be host again, okay? And then can you let people into the meeting?
So admit Nina, whose iPhone? I don't know who's joined by iPhone.
Just let everyone in. Yeah.
Okay.
Okay, so you're in charge now.
So should we start?
Okay, so Miriam's going to introduce you.
Mariam, we cannot hear you. We can't hear
where's your voice? Okay. Okay, how about you want me to do it then?
Can you hear me?
Yes, go ahead.
Yeah, that's good.
Thank goodness. Okay. All right. Hello, everyone. Assalamu alaikum. I just wanted to take 2 minutes just to welcome everyone. Thank you for taking the time out of your day to join us today on a really, really important topic, considering we are all affected by this. So it is on learning about COVID-19, the myths versus the reality. We have a very valuable member of CCMW, Dr. Amreen Akhtar. As many of you know, she's a physician. She has extensive experience and has specialized degrees from France and postgraduate work from York University. Her resume is impressive. So I request all of you, if you're interested to know her expertise and her background, she has a beautiful resume and bio on the CCMW website. So please take a moment to go read the information there. So Amreen, welcome. And thank you for taking the time out of your day as well to present to us. We really appreciate it. And I certainly, for one, am looking forward to hearing what you have to say about the information.
Okay, thank you so much. I hope everybody can hear me properly. Can you hear me, Miriam?
Yes, I can. Please go ahead. Oh, and just a side note, if anyone has any questions, please feel free to put them in the chat and we can address them depending on the question and what Amreen is saying. I can interject and Amreen, you can answer at that moment, or we will hold it for after the session. Great, so go ahead.
Okay, sure. Thank you. So thank you so much, Miriam. And first of all, I would like to thank you, all of you, for joining this session and this webinar. So, and thanks to Cobra and Canadian Council of Muslim Women Durham region for holding this seminar and giving me a chance to talk with everyone. So today, basically, as Miriam mentioned, that we are going to discuss COVID-19 myth versus reality. So most of the emphasis will be on myths regarding the COVID-19 vaccination and also where are we right now in terms of pandemics. So I will give you a brief layout of what we are going to discuss today. So where are we in terms of numbers in Ontario? And where are we now in terms of pandemic on the pandemic curve, and what is long COVID-19 and how we can prevent ourselves from getting this virus infection. And something about infodemic. What is infodemic? And basically we are living in a social media world where we have a lot of information coming to us. And unfortunately, lots of information which is being spread on social media. Lots of, till now, there are studies which have shown that more than 60% information revolving on the social media regarding COVID-19 and vaccination is not correct. So I'm going to briefly touch about vaccines and what are the myths revolving around it. So these three, four slides, I will rapidly pass through them just to give you an idea where we are standing at the moment in terms of numbers. So in Ontario, there are about more than 327,000 patients suffering from COVID, have suffered or have been recovered till today. And the number you can see here that average 7-day number is almost 1,500, more than 1,500 cases are being reported in the last 7 days. In terms of deaths, it's so unfortunate that so many beautiful people have lost lives because of this virus. More than 7,220 people have died because of this virus. These numbers are till, I took these number last night. It's representing till March 20th actually. So at the moment, there are 765 people hospitalized. So when I emphasize a lot on this number, the reason is being when 765 people are hospitalized and they are occupying these beds, it means 765 other people who need the hospitalization cannot access those beds. So this virus is not only affecting people who got infected because of it, but the other people who are in need of cancer patient, surgery patient. So many procedures have been delayed just because that we don't have enough capacity inside the hospitals. So now coming, where are we in the pandemic, in this pandemic? This pandemic started about a year back. So give you a perspective of pandemic, I'm going to just, this picture is going to give you an idea, recent pandemic which happened, recent history, and about 500 years back. The first pandemic in recorded history is of smallpox, which happened around 1520, then Spanish flu in 1918 to 1919, then was the SARS, which is 2000, it's recent, 2002 to 2003, and the MERS. SARS is severe acute respiratory syndrome, and MERS is Middle Eastern respiratory syndrome. And the number here are very low. There are different reasons behind it. I'm not going to go in detail. And currently we are facing the pandemic, which is COVID-19, which started in 2020, and up till now 2.5 million people have died because of this, which is really very unfortunate. So now I'm going to take a pause here a little bit, just give you an idea. What do you think, you guys, that how long every pandemic, based on our knowledge about the pandemic last? Is it 4 to 5 years? Is it 12 to 36 months? Or is it 6 to 12 months? Or what do you think? You can write in the chat, or you can raise your hand, or any one of us can get to you. So what do you think? Or you can unmute yourself and you can give your answer too. That's another option. So Miriam said, Kubra said about 4 to 5 years. Miriam said 4 years. Nina said, I think 4 years. So Samira said she cannot say that how many years it will last. So the correct answer on the basis of our knowledge regarding the pandemic, the answer is number 2. Most of the pandemic stay around 12 to 36 months. This is what we know about the pandemics, depending upon the knowledge which we got from the previous pandemics. You might have heard about the pandemic waves and the pandemic curves. Actually, this curve or pandemic wave is based on the Spanish flu, which happened in 1918 and 1919. So the pandemic comes and goes in waves. Actually, what happened is, when first wave come, the people get scared, they take more precaution, they stay inside, the number goes down. After some time, when the number goes down, the people lose that guard and that they stop taking care, and then again the number goes up. Not only that it's an individual decision, but also what happened is, when the virus revolve around the world, it changes its shape. It become more potent, it become more infectious. So what happened is, it comes back with more severity. So that the same thing happened, then the people start, there are some measures taken, the government responds, the people response, the public health measure, the number goes down, and it again, after some time, the mutation has happened. If the new mutation add up into the variant, then the numbers start going again and again. So that's how basically the pandemic waves look like. We are almost around here somewhere. We are again going toward the top, but you know what? This peak can be prevented. This peak can be flattened. This peak can be flattened by measures we can take individually and as a community, the measure which we take. And nowadays we have got vaccination. This peak can be flattened by getting more and more people vaccinated. So this number is basically, these projections are showing this line, which is red in color. It's the worst case scenario when nobody takes any care. This purple line is basically currently where we are. And this is an ideal situation when everybody take care, wear mask, universal mask strategy, then we can decrease the number drastically. And it's a good sign that we are somewhere, current situation, we are close to the what it should be happening. And we should not let our guard down, because we are still in that time period of 12 to 36 months when we can go, the numbers can go high again anytime if we stop taking care. This same graph for the projection in Canada, we are following the good trend, and that's good thing because people are taking care and wearing the mask. So look at this picture. I'm gonna go back. This is giving you a layout of how the different variant come and got add up into the old, the wild type COVID-19 virus. And you can see these are the numbers. First it came out to be Danish variant, then UK variant, then the South African, then the Brazilian variant, and this one is, and this one is the Brazilian, and these are adding up. But there is currently what is happening till April 2021, UK and South African variant will be dominant variant. This is an unfortunate situation, but that's how it is actually. The wild COVID, which started with, which would be started, and we developed a vaccine on the basis of that. It will not be the dominant variant, but the UK and the South African variant will be dominant till 2021 April. Okay. I'm not going to go in detail about each and every step what has happened here in Canada in terms of number of variants, but I'm going to emphasize on the fact that variants spread faster. So by term variant mean that the virus has developed a better key to stick to our cells and enter in our body. It has become more smarter. It has developed a better key to stick. Again, I'm gonna say that it stick to ourselves in a better way, and it can enter in our body in a much better way than the previous one. So these are different type of variant which are mostly here. The UK variant, you can see it is 71% more transmissible. It means it can spread faster. South African variant is 50% more contagious, and Brazilian variant is also more transmissible. That's the reason, because when the third wave come, that is what has added up of bringing the third wave, that virus has become smarter. So as I mentioned in the beginning that I'm going to discuss about long COVID-19, I always want to emphasize on that many people think that when we get infected, we get cured within 2 weeks and that's it. But the studies have shown that many people have the symptom which stays with them more than 60 days. And that condition or that syndrome is known as long COVID-19 syndrome. The symptoms can vary. It can be fatigue, people can get breathless, they still have joint pain, chest pain, vision problem, headaches, their sense of smell and taste is impaired, and people have shown this symptom up to 60 days and even after that. This syndrome is known as long COVID syndrome, and people have basically, more and more people are coming, as we know more and more data, more and more people are coming with this syndrome. So again, how can we protect ourselves? You can write your answer in the chat. What should we do? I think everybody knows the answer, but it's just to give a realization again that how can we protect ourselves from getting the virus and getting ourselves and our family prevented. Hag everyone. Cobra, I like your answer, you know. So yeah, you are right, wearing double masking, vaccination, load up on vitamin D3. Okay, go to parties. Cobra, I think you are just
I'm being the devil's advocate.
No, yeah, like
Too many
most
people
of
going to parties. Keep the numbers. What is the numbers for people right now? How many people should you be having in your house?
me,
Yes, I think it's
only
only
five
five.
people, and nobody,
Yeah.
only they have allowed only those people who don't have anybody else to go with, to go to other household. Otherwise, it's not advisable.
Yeah. Okay.
So most of you are right. We can prevent ourselves by double masking or wearing a, even double mask is recommended, but it's not mandatory. The purpose of double mask is to increase the way we protect more, because many people who are wearing masks, they are not wearing properly. So when they are wearing double mask, maybe they will be more careful, and plus it create more barrier. I myself always wear the double mask, and it is advisable, but it's not mandatory. Either you wear a very fitted mask, single mask will be sufficient, or if you cannot, you do not have a, wear in a way that it should protect, it should not be leaky from all sides. Vaccination is another way, sanitization, cleaning your hands and sanitizing your hand and maintaining the social distance. So this picture I want to show you because I have seen people wearing mask, but the mask is not proper. So when the mask is hanging below your nose, that's not proper mask. Half chin is exposed, half nose is exposed, that's not proper mask. Mask hanging in our ear, that's not proper masking. The mask should be, it should be above our nose bridge, and it should be tied and below our chin, and it should not be loose around our ear. It should be quite fitted so that the air we breathe in should pass through the mask layer and then goes inside. So infodemic, what is infodemic? Actually, we are living in a world, this pandemic is different from other pandemic in terms that this pandemic is happening in social media world, where we have access to social media, and so many news are coming to us. So much information is coming to us by social media, by text, through Facebook, Instagram, and we are not, a human mind cannot, because people who are not working in this field and not health related, many times they cannot differentiate what information is correct and what information is incorrect. So this is not only pandemic which we are facing, but we are facing another pandemic inside the pandemic, which is infodemic, which is incorrect information going everywhere. So this is a very good picture which I took from WHO websites, that this a person didn't send a rumor to the group chat, and he stopped many people from getting that wrong information. A person would keep spreading, sharing the without checking that whether this information is correct. They are sharing, so all those people who will get that information will get the wrong information. So this is a very good representation. How can we prevent this rumors or wrong information spread fast? The top tips for navigating the infodemic: assess the source. Before sending, make sure that you have double checked it from where it is coming. Go beyond the headlines. Just don't look at the headlines. Read below from where that information has come. Identify the author, who is sending that information. Check the date. Is it a new data, or is it a 1 year back data, or is it related to something else? Examine the supporting evidence, the evidence which has been provided in that information. Do you think it's correct? check your biases. Go to the internet. If you don't know anybody around you, if you don't know how to access internet, there are so many information you can call. Public health numbers are available everywhere to make sure that that information is correct. Turn to the fact checkers. Right now you have access, you have phone in your hand and you can check your facts immediately. Anybody who can use phone can look at, there are apps, there are Canada health apps, there are Ontario health, public health apps. You can download them and check those facts. So coming to vaccines. So although this is a very good news, that this is also good news in terms that we got the vaccine very fast in this pandemic, and there are few vaccines which are either in developmental phases or which have been approved. Pfizer, BioNTech, Moderna, we have AstraZeneca and Johnson & Johnson also in the line. So the other world, there are many. Sinopharm is from Chinese vaccine, which is being used in many countries too. I'm not going to go in detail of each and every vaccine. Whatever vaccine you get the chance to here in Canada, you should opt for that. So these are the vaccine. Pfizer, time period is 21 day. Moderna, in between two shots, 28 day. Janssen, there is only one single shot, which is and AstraZeneca, 28 days. So this one I'm going to show to everyone, and I have downloaded this from Ontario vaccination rollout website, and this is the most recent one. You can look at in what category which you fall in. So most of the people who don't fall in any category, they can book themselves for vaccination from moving onward from July. But the people who are 60 to 79 year high risk congregate settings such as shelter, community living, individual with high risk chronic condition, those who cannot work from home, at risk population, they are eligible in phase 2, and which will be starting from April 2021 to July 2021. You can check this. This is a picture I just screenshot from the Ontario vaccination rollout. This is just a map which is showing how much population have been vaccinated up till now. 6.8% population almost have got at least one dose of vaccination. These are some updates just for the information. So now we are going to come to the major topic, which is myths revolving around vaccination. Many people have concerned about quality control, side effect, associated COVID-19 illness, wait until tested by other, wait for next year, pregnancy, doubted the efficiency, COVID-19 symptoms are mostly mild, so why should we get vaccine? Physiological immunity is better. So these are the people who have shown different kind of myths which are revolving around it. And I'm going to discuss briefly about the myths, but if you have any question, you can unmute yourself and stop me there. One myth is, if I have already had COVID-19, I don't need a vaccine. This is not correct, actually. This is wrong. What happened is, when you get COVID-19 virus infection, you will be immune to getting the reinfection for next 4 to 6 weeks. The data shows up to 90 days, but most of the people less than 90 days. 6 weeks or 4 to 6 weeks the time period. Because of new variant, you can get reinfected faster. So the viral infection will give you immunity only for 4 to 6 weeks, but the vaccine will give you immunity longer. It can be up to years, although they are still under study, but it is far more than 6 weeks. It is more than years, obviously. So that's why even if you get infected, for God forbid, you should get the vaccination. Second myth, getting the COVID-19 vaccine means I can stop wearing my mask and taking coronavirus precaution. That's not true. That's totally incorrect. So what happened, when you are given the vaccine, your body has developed a mechanism to fight against the virus. It means you will not get the disease, or you will not get the severe disease, but you can still carry the virus in your nostril, in your mouth, and you can still spread. This precaution has to stay there until 70% of the Canadian population, or let's say world population, have got immunity against the virus. Till then, we have to keep wearing masks and maintain the social distance. The myth is the COVID-19 vaccine can affect women's fertility. Actually, this is not true. This is incorrect. This is a myth. But rather nowadays, new research is coming up. There are still that the babies who are born to the mothers who got COVID-19 vaccine already have a kind of immunity, already antibodies in their body. So it is actually not at all going to affect any woman with a fertility, or if somebody is pregnant. Getting the COVID-19 vaccines give you COVID-19. So the vaccine for COVID-19 cannot and will not give you COVID-19. So what is happening right now is messenger RNA is a kind of message to the body that now this is some messaging, this is some code which we are giving you. You have to develop some kind of defense against it. So body develop the antibodies. It's not the virus which has been injected inside your body that you can get the COVID-19 virus because of vaccine. So this is totally a myth. So many times I hear that how can the vaccine be developed so fast and blah, blah, we have missed so many steps. And I understand this concern, and I have answered this concern a lot of time, but because you know what happened? The COVID-19 virus is a coronavirus, and the coronavirus is infecting human population for long. Even the SARS and the MERS virus also belong to the same family. So the scientists are working on coronavirus vaccination for long. So it's more than a decade that the messenger RNA technology have been developed, and it was under research. So what happened this time was that immediately, maybe the pandemic was declared in March 2020. So the Chinese scientists were able to identify the gene sequence in February 2020. So that have fastened the process, because when you do not identify the genetic sequence of the virus, then that takes time. So what happened, we identified the genetic sequence of the virus. We knew the messenger RNA. So we faster, that process become more fast. And that's why it came into effect faster than before. So don't worry about it, that there are 100 and 1,000, rather up to 30, 40,000 people have been tested before it has been approved. The side effects of COVID-19 vaccine are dangerous. This is a myth actually. The COVID-19 vaccine can have side effects, but the vast majority are very short term, not serious or not dangerous. But getting a virus infection and spreading to other people, and which lead to death of many people, is much more severe than the side effect of the COVID-19 vaccine. Till now, there are very minor side effects have been reported. You might be hearing a lot of side effect talking about the AstraZeneca. They are still working on that, and they have come up to an idea that the people, I'm not going to go in detail about that, but the reason is the BioNTech, Moderna, AstraZeneca even have given millions of people, and nobody have reported any severe side effects. The COVID-19 vaccine enter your cells and change your DNA. The two COVID-19 vaccines available to us are designed to help your body immune system fight the coronavirus. So messenger RNA is a message which is given to your body that it has to develop some kind of defense mechanism. So in the future, if you get the virus, you will have the ability to fight it. It does not enter in your genetic sequence. It's just the message to your body to produce proteins. So you should not worry about this. This is totally a myth. The messenger RNA technology used to make the COVID-19 vaccine is brand new. No, this is not a brand new technology. It is there for almost 2 decades. decades, like 20 years or more. It's an old technology, and people were trying to work on this and for other diseases actually. So don't think that it's a new technology and we are being used as a guinea pig for this technology. It's a 20-year-old technology. The COVID-19 vaccine was developed with or contained controversial substance. No, that's totally wrong. The first two COVID-19 vaccines to be authorized by FDA contain messenger RNA and other normal vaccine ingredient. You know, we all get vaccination against all those infection, TB, hepatitis B, polio, then smallpox, chickenpox. So when we are getting those, so there is no controversial substance which has been used in the development of COVID-19 actually. So it's a myth. And you know, and you will see that at the end of each slide, I have given a link here. This is the link of John Hopkins. So all of this information which I am presenting to you, it's taken from John Hopkins website, and it has been researched thoroughly before it is put there. So now that we have a vaccine for COVID-19, we can make vaccine for common cold, HIV, and other diseases. So because you know the viruses, each virus behave in a different way. I wish we can develop the vaccine against HIV and common cold too, but each virus behave differently. So this is how the virus work actually. So each an individual virus, maybe the messenger RNA technique will not work for other viruses as it worked for COVID-19. So this paper I got it from one of our Ontario physician who basically most commonly asked question here in Ontario. So it means I have almost discussed most of it. One is that it should not be given under 16 years. That's correct, because what has happened, it does not mean that it can cause some problem. The only reason they have not recommended is that they have not tested that population for this because and that's why they don't recommend it, and that's why it's not recommended for the people under the age of 16 years. So I think that's all from me. If you have any questions, you can ask me. I am here to answer any questions.
There are some questions, Irene, so thank you for that presentation. That was awesome. It certainly helped me. You did answer some of my questions, so I found it incredibly valuable. There were some questions. Sorry, I just lost my chat here. Just a simple question. Would phase 2 make...
You are, I cannot hear you, Miriam.
To getting the vaccines? I think they're doing it in groups.
You were cutting, so I think Miriam, you were asking the Danish question that would phase 2 make retail employee eligible? That's the question you were asking?
Yes, I was.
Okay, so yeah, as I shown you in the picture, because the people who cannot work from home, exactly what category of worker will be getting it, but according to that list, it looks like that the people who cannot work from home will be eligible for vaccination. You can definitely check with the region where you are working. Oh, it's you, Kaniz. Hi. So, you know, Kaniz, what is that he should check? You live in the York region, I believe, so you should check with your York region public health. But according to the phases which they mention on website, it looks like the people who cannot work from home, they will be eligible for vaccination.
Awesome, thank you.
I have a question. Assalamu alaikum, everybody. My husband is in his early 70s, and I don't see anywhere where they say, you know, people of that age can go, that they talk about 60 to 64, 80 and above, but nothing in between. So where do they go to get their shots?
So thank you, Saida, for your question. So according to this new phases which they have shown, I think he will be eligible, 60 to 79 will be eligible for phase 2. So he will be eligible for getting the vaccination starting April.
Okay, that's wonderful. Thank you so much.
No problem.
I have one more question.
Actually, I just want to pipe in here.
Carry on.
It's okay. Go ahead. Go ahead. Go ahead.
Thank you. The one question that I had, Amreen, was is one vaccine brand better than the other? The reason I ask is because I'm going to get my mom vaccinated. She's in her 80s. Is there some way to figure out which would, react better with her?
You know what, Kenise, right now they are saying whatever vaccine you get is better than no vaccine actually. So if your mom can get any vaccine, go for it. So because we cannot control at the moment, we don't have choice of choosing among which vaccine we will be getting. But there is, they are saying that most of the vaccine which are being approved here in Canada, they are effective 80% and above, and this is a very good rate. So she should get whatever she can. So there is no such recommendation that the one person should get this or another should get. And I think we will not be given that choice even.
Okay, all right, thank you.
But most likely, I think most of the people which I am hearing is Moderna vaccine will be more. And even with the shipment of Pfizer, millions of doses coming. So Moderna and Pfizer will be the more dominant right now in Canada because people are, that's what I'm hearing from other people who are getting the vaccine. They are either getting Pfizer or either getting Moderna.
So is it like
my
one
parents got the
dose or
Pfizer.
there are 2 doses that they have to take?
Two doses, but the 2 doses, the 1 dose will give you 50% protection. The other dose will give you another 50% protection. So there is a question I'll see that if there is new variant come, Nina asked that if there is Australian or Korean variant. Nina, we hope that there is, because till now all the variant which have been recovered, the vaccination specifically for South African variant, that needs a booster dose. But the UK variant can be okay with the current dosing schedule of the vaccination, but South African might need the booster dose after even 2 doses. They are in a process of developing the new vaccine because that process will now fast up because we know the genetic sequence, everything of all variants. So I believe there will be a booster available soon for some rare variants actually. Vitamin D question have been asked by you, Kenise. So regarding vitamin D, it cannot prevent you from getting infection. Vitamin D has shown that it decreases the symptoms up to some extent, but it cannot prevent you from getting the infection. Okay, now who else have the question? They are now giving 2nd dose of Pfizer after 4 months. Yes. The purpose of this is actually, as I mentioned that 1 dose always protect you 50%. And the 50% protection will be given after the 2nd dose, so 100% protection. So they have discussed it and they have come to an idea that if we can immune even larger population up to 50%, that's better strategy than not to protect people altogether. Let's suppose I'm giving you an example. If there is a community where there are 100 people living who are above 80 years of age, and we decide we have only 50 doses, and we decide we will just give only 50 people those doses, 2 doses, and we will leave those 50 people altogether. So what will happen if the outbreak in that population happens, those 50 people who are not at all immune, they have very high chances of dying because of infection. But if we give 1 dose to whole population, there is a possibility that those 50 people will also get minor, some kind of immunity against the virus, and their body can fight against the virus. That's why that strategy has been developed, and it is happening in many parts of the world. So whatever the decision, health, I have worked with different health organizations. So Health Canada is very, 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 they if they take some decision, they do a lot of scrutiny, even more than United States actually. So if they have given this recommendation, so I believe on them, and we should all believe on that. They have given it a lot of scrutiny, and they will not put people at risk of any kind of risk. So if I am missing some question, let me see. Welcome, Nina. Nina is the president of CCMW National. Any other question anybody have? If I have missed reading it, kindly let me know.
Thank you,
Sure.
Amreen. I loved your presentation. It was excellent. It's evidence-based and easy and clear to understand. And everything you said, I concur with. My husband's a family doc, and he just worked at the vaccine clinic in Burlington here today, came home an hour ago. They've been giving out the Pfizer vaccine to over 80-year-olds, and they're encouraging everyone to take the vaccine. You know, they've talked, for instance, in the news, if you have had any allergies, there is one component in the Pfizer vaccine which is found in PEG flakes. It's like a polyethylene glycol, I believe. And most people have never had a reaction to that chemical. And also an mRNA. Ambreen, have there ever been any vaccines made with an mRNA delivery system before?
So messenger RNA vaccination was under development, but they have used this for the first time. They have used it in other diseases.
Okay.
But not in vaccination.
Got it. Okay. Yeah.
So that's what they are talking about, this messenger RNA. When they have used and it has worked, it has opened so many horizons for so many diseases, even the Alzheimer's, and there are so many diseases this will be useful in the coming days. And right now I have listened to so many, the Pfizer, BioNTech, and many companies, CEOs and people. So they are emphasizing on this fact that right now this messenger RNA vaccine, they have developed this vaccine. They have not considered their profit a lot, but the technology which they have earned, they can use and make so many other medications which will be used for other diseases actually.
Right. I just keep thinking about that Turkish couple in Germany and all the scientists around the world who have worked tirelessly to get to a vaccine for this pandemic. May God bless them. And
yeah, that's true. May God bless them.
Incredible. I think there's going to be, like you said, there's going to be so many advancements in the field of medicine now. You know, with everything bad, we know there is something good. And yes. I think there will be a lot of good coming from this, inshallah.
Inshallah.
Thanks again, Ambreen.
Thank you.
Soraya, did you get your questions answered?
What was Soraya's question, if I missed it?
I'm just trying to remember her. Remember, I sent it to you.
You texted me? Let me open it.
I texted you earlier. So her ones were, are you still at risk despite having taken the COVID shot?
You know, if you are at risk of developing the virus, yes, you can develop the virus infection, but your body will fight it much better way. You will not get as sick as you get normally. You will not develop complication. People will not die because of it. They will get very mild symptom and they will recover soon with the vaccination.
Okay, and her second question is, just a second, let's turn off my phone.
I got it. How effective is the 15-minute test?
Yep, that one.
Okay,
Yes, please.
so 15-minute test is only recommended for the people who are just going for screening, no symptom, no exposure, no underlying health issues. All these people are going for that test. So in this case, what I have seen and observed and read is about their false positivity rate is very high. Not high, you can say it's actually good to have a false positive than the false negative. You got my point? For example, if somebody, 5 people got tested and 5 of them do not have virus, but this test will say that 1 out of 5 is positive. So what will happen? They will send that one person who got tested positive through this method for a nasal swab method, which is a PCR method. So in order to confirm whether that person is a true positive or was it a false positive. So this technique is good in detecting people or screening, but many people who are not infected can still be tested positive, and which can be reconfirmed by PCR testing. So what happened is, let me explain to you, because when we do the nasal swab method can detect even 1 to very less number of viruses. But this blood or fast testing, it means person has to be infected with millions of virus, then that test will be effective actually. So that's why it is good as a screening tool, but it is not confirmatory testing. If you have negative fast test, I will emphasize on that fact. You have a fever, you have a suspicion that you have virus, and you go for testing, and they check your file, although they will not first of all let you go in and with the fever and get tested, but your test turned out to be negative. Don't go for that test. You have to still go for the PCR and nasal swab testing, because that is a gold standard. This is not. This is only for asymptomatic people who has nothing, no symptoms.
I mean, one of the main reasons, thank you for that, Ambreen. The main reason I asked was because my mother is in a long-term care facility, and so to go and see her, I have to get myself COVID tested every week. However, this time when I went, which was day before yesterday, they wanted me to do the this antigen testing also over and above that, I guess, they've had a few deaths, and I guess they want to be overly cautious.
So to answer your question,
Yes.
15% of positive people can be missed through this test. So for the rapid testing, that's why they don't want to miss those 15% people.
Thank you so much. Thank you.
15% is a lot.
Yeah, so that's why it's not a gold standard, but it will detect 84 to 85% people, but it can still miss 15 up to 15% people. It's just like, the pregnancy test. You do the pregnancy urine dipstick, many times it's false positive, and you go and do the blood testing, and it turned out, oh, you are pregnant, and your urine testing showed no, you were not pregnant. So it's a kind of that kit method, So even when you're tested positive through your urine, many times doctors again prescribe you beta HCG level and ultrasound in order to confirm the pregnancy.
Okay.
So Nina's question is, if your kids are under 16 and cannot get vaccinated, do we still take the risk of sending them to school? So Nina, this is a very controversial topic. Many have in favor and in against it. But when we look at the overall impact of kids being home, is far, that impact not only the mental health of parents, but also of the kids. So that's why that sometimes the decision have to be made where they decide that kids should go to school, that's better, with all precautionary measures. But if 70% population adult have been vaccinated, So the good thing about this virus is that it does not give very severe symptom in kids actually. Nina, I know I don't want to touch this topic because many people have different opinion about this, because there are even the scientists are not agreeing on this concept of sending or not sending. Any other question?
Is there anything else? Nope.
So we are almost 4 o'clock, I think.
Yeah,
So
we're for time now, guys. So
that's good. We finished in time. I was worried I will not be able to finish.
perfect timing, Amreen.
Actually, I like your presentation, and just to tell everyone, I will be asking CCMW to put on their website. This was so interesting. I had no idea the stuff you're telling us. So
Yeah.
thank you for sharing your knowledge, Amreen.
Yeah.
And thank you for approaching me. You know, when you told me, I thought, I wasn't sure. But alhamdulillah, I think this is such a valuable information that you've shared with us. So thank you.
No
Yeah.
problem.
So I just want to take a moment to thank everyone for your time for attending today. Hope you all find it very informative and had the opportunity to ask your questions and dispel some of the myths that we were probably carrying around with us. So Amreen, thank you again. That was an excellent presentation.
Thank you, Mariam.
really
Thank you,
well done.
Kubra, for hosting and arranging and bringing everybody together.
Yes, no, it was excellent. Thank you.
Thank you.
All right, everyone. Have a great
Thank you.
afternoon.
Stay safe,
Okay.
everyone. Bye-bye.
Stay safe.
All right. Okay, take care. Bye-bye.
Assalamu alaikum.